everybody. Good afternoon. Thank you so much for joining us this afternoon. Appreciate such a great turnout. My name is Cindy Samuelson. I work with the Kansas Hospital Association, and I'm happy to be here today to kick off our Centers of Excellence Award for Children's Mercy. So, who is the Kansas Hospital Association? We have been around since 1910. We are the trade association for 125 community hospitals in the state of Kansas. So all the hospitals in Kansas are members of the Kansas Hospital Association. This award is from us as well as our foundation, the Kansas Hospital Education and Research Foundation. Now KHERF, as we call it, because we are in healthcare, everything has an acronym. So KHA and KHERF have worked hard on this award. KHERF is actually celebrating 50 years this year. So they were established in 1969 and has been going for 50 years strong. So we're really excited to be giving awards this year on our 50th anniversary of KHERF. So a couple things about the program before I turn it over to our president and CEO, Tom Bell. I just wanted to make sure you guys understand the background of the program, which started in 2013 with the foundation funded program, and then in 2016 it transitioned to an all-over KJ program. So it's been going since 2013. This is the 9th hospital in the state that has won a Centers of Excellence Award since the award was established in 2013. So congratulations to Children's Day. The program, Healthy Kansas Hospitals, we actually partner with our members across the state as well as communities. Our goal initially was to focus on improving food and beverage options in hospitals statewide to make sure, as our slogan says, healthy options are an easy choice for individuals, not just patients, but visitors and employees as well. So we focused on working not only in big picture areas, but smaller spaces too, to really make policy change that will be long-lasting in hospitals. So we're talking about cafeterias, vending machines, and employee meetings, all kinds of areas where we can make healthy food and beverage an easy choice. We've tried to really focus on limiting sugar-sweetened beverages, which I know is a focus of your areas as well here at Children's Mercy, and really enhancing employee education, which I know you guys are focused on as well. So without any further delay, I'd like to introduce Tom Bell, President and CEO of the Kansas Hospital Association.
Cindy, thank you for those comments. And I am the President and CEO of the Kansas Hospital Association. I just want to make it clear, despite the color of the hair on my head, a little bit of it, and my face, I have not been the CEO since 1910. I'm sure you all know. You know, this is absolutely my favorite thing to do in my job. Come to hospitals which, you know, take care of folks at their absolute most vulnerable times in their lives, and especially Children's Mercy, to take care of the most vulnerable people in the most vulnerable times of their life, but also to recognize a hospital like Children's Mercy for some of the great work that it has done. So it's absolutely the favorite thing that I have to do. And let me just say while I'm mentioning that, those of you that work here, thank you for what you do. We don't thank our healthcare providers often enough, and we put you in some extremely difficult situations and ask you to do things that are almost impossible. So thank you for what you do. It is very much appreciated. This program is, as Cindy said, it's something we've done for a few years, but every year it gets a little bit more timely. When you look at the way we are headed as a society and really as a healthcare system in terms of recognizing things like population health and social determinants of health and just being a system of health as opposed to taking care of health problems, things like Healthy Kansas Hospitals fit right in. They're exactly consistent with what we're trying to do as a health system. Get out in front of problems, set an example for good health, and we hope this program is something that does that. So let me just say again, thank you very much for being here, and it's my pleasure to introduce Paul Kopinski, who's the President and CEO of Children's Mercy. Again, Paul, thank you so much for what you all do, and we're very proud to recognize you today.
Hi, you're proud here. Welcome, everybody. First of all, Tom, I want to thank you and the Kansas Hospital Association for this award. This means a great deal to us because, as we know, healthcare is shifting. And at Children's Mercy, we will never lose sight of the way we impact the individual child and the family. But we also know that healthcare is shifting to bettering the lives and improving the health of the community at large. And that's what we are very committed to. And recognitions like this give us some sense of the progress that we're making, which I'm very proud of. I'm proud of the leadership that we have. You'll have an opportunity to hear from Candace in a moment. But all of our 8,000 employees throughout Children's Mercy, including the thousands of employees that are based in our Kansas facilities, including our hospital right here, are contributing to this work every day. Not only focusing on improving the health of the communities we serve and the patients we care for, but also taking care of themselves as well. Because healthy caregivers will be better caregivers, and we are committed to that. That is a journey. We're proud of this recognition. We're proud of what we've accomplished, but we also know that we have a long way to go, and we are very committed to that. We are also thankful and proud of the fact that we are the Children's Hospital for the state of Kansas, and we have 10 facilities throughout the state in which we provide access to world-class children's health care and health in the communities where those kids live and reside with their families. So we're proud to be such an important part of the healthcare community within the state of Kansas. We're proud of our contributions to wellness and well-being. We are committed to continuing that journey, and rest assured, I hope we're back here again in the not-too-distant future receiving another one of these awards because we're going to work hard to earn it. So with that, I want to introduce Candace Gwynn. She is the Employee Wellness Program Manager for Children's Mercy. I'm very thankful for her leadership and the support of so many team members in making our programs come to life. And Candace will tell us a little bit more.
Thanks, Paul. I appreciate it. And thanks, everybody, for coming. I really appreciate it very much. And Cindy, you made me a little nervous when you brought up the sugar-sweet beverage issue. I'm just now healing from when we eliminated added sugar beverages from the hospital. So, all right, again, thank you all very much. And I want to thank Paul for his leadership. You know, Paul's been here for about 7 months now, and he has been a very visible supporter of all things wellness and our well-being initiatives. So thank you so much. I look forward to working with you in the future towards further goals. So we've been doing wellness now at Children's Mercy for about 11 years. And throughout the 11 years, we have been privileged to have senior leadership support. As you all know, it takes a team to make a good well-being program. It's not just one person. It takes a wellness team. It takes people like you all. I see a number of people in this room who have either supported our programs, participated in our programs, and been a cheerleader for us. So thank you for that. It also takes great colleagues, like my manager, our colleagues in human resources. Not only do they support what we do in wellness, but they shoulder some of the burden of promoting it, of getting it advertised. In addition to that, I would be remiss if I didn't thank Maureen and our communications group, because thankfully, they make me sound a lot better than I would ever sound on my own. So thank you very much. I appreciate that. So we take wellness really seriously at Children's Mercy, and we take your all's health and well-being very seriously. And one of the reasons we do that is we know as you guys take care of yourselves, you take care of your health and your well-being, then you're better equipped to take care of those children that we serve. And that's really what Children's Mercy about. It's about those children and taking the best care of them that we can to help them improve their own health and their own well-being. So as you guys take care of yourselves, it only trickles down to the family and the children that we serve. So thank you for taking on the challenge to take care of yourselves. And we've had great success at Children's Mercy. I'm proud to say that about 75 to 77% of our employees participate in our programs, and about 56% of our spouses covered under our health plan participate, and we're excited about that. But we don't want to rest on our laurels. We want to grow our program and continue to grow and continue to try and offer things that would be interesting to you all. And I would say if we don't, please let me know. I mean, I've been doing this for a really long time, and the more I know, the more I don't know. So if you want to try something new, please let us know. I'd really appreciate that. One of the things that we are going to try this coming year is we're going to partner with our on-site wellness center to provide an on-site diabetes prevention program. We know that diabetes is prevalent in our society as it is at Children's Mercy. And so what we want to do is offer some tools and some resources to prevent this disease from furthering. And so in addition to the on-site program, we're partnering with our partners at Cigna through Amana Health to provide an online program. We're pretty excited about it, and so you're going to hear a lot more about it in the upcoming days and months, but that's just one of the many things that we're going to start this next year this June. So with that, I want to thank Cindy and Tom and the Kansas Hospital Association for this award. As Paul said, we are going to do everything we can to deserve this award and earn it back again, so thank you.
Don't go far, we have to take a photo op because one of the parts of this program that we love is giving back to the hospital to help further this work that you've discussed. So we are giving you, in addition to the award, which is something you can set up very easily in a place where you're serving a healthy meal at a meeting or someplace you can display this award. We also have a check for you for $1,000 to go back to your initiatives to focus on wellness. So congratulations. You guys getting the check, I wanted to also thank Haley. Haley Finch-Genshork on our team is right back there, and she's worked on this award. We have 85 hospitals that have signed policies, or have signed a pledge to work on policies, and 58 more that have actually made policies in our state. So without your work, that wouldn't be possible, so thank you so much, Haley, for all the work. Paul and Tom, Candace, and maybe your wellness committee or folks that are here, come up front and we'll take a photo with your check. Whoever you would like to.
No.
Pictures.